First, we'll hear from Senator Crapo.
Thank you very much, Mr. Chairman. And before I begin my formal remarks, I will say there's one thing you and I agree on. That is, we've got to control drug prices. And you already referenced it. You see a number of folks here in the audience in white coats. Those are pharmacists. And we met on the grass out in front of the Capitol today, Senator Wyden and I did, with hundreds and hundreds of them to talk about one of the most important things we can do, which we need to do right now, which is to get the PBM legislation, which passed this committee 26-0, on the books so that we can start one of the most significant things that can be done to help control drug prices. So I want to focus on that. We do have our disagreements still on what we consider to be the price control program and the impact of it, but we've got places where we've got agreement, and I'm hopeful that we can make progress on that right away. Back to my formal remarks. Thank you, Mr. Chairman, and thank you, Secretary Becerra, for being here today. Over the course of the past year, the Finance Committee has taken bipartisan action to tackle a range of healthcare challenges, leveraging collaboration and consensus to advance common sense solutions for seniors and working families. Our pharmacy benefit manager reforms, which I've already referenced, would modernize Medicare's prescription drug benefits, driving down costs at the pharmacy counter and netting billions in savings for taxpayers. Moreover, the committee's mental health proposals would build on previous efforts to shore up patient access to critical services, especially in rural communities. These policies received nearly unanimous support from across this dais, all through regular order. Your department and its sub-agencies, Mr. Secretary, have offered essential technical assistance throughout these processes, and that support has ensured alignment between our legislation and its intended goals, and I thank you for that. As we move forward, further action on these overdue patient-focused proposals must become an urgent priority, not just for our committee, but also for the administration. We have a responsibility to patients, community pharmacies, and frontline healthcare providers to deliver on these commitments, regardless of policy differences on other fronts. The President's budget request, unfortunately, falls severely short of that aim. On prescription drug affordability, for instance, the document makes virtually no mention of the robust bipartisan, bicameral efforts to reform PBM practices, instead opting to double down on a price control policy that polarizes members in both chambers. Bipartisan bills in the Senate and House would address unintended consequences spurred by the Inflation Reduction Act's pricing provisions, particularly for patients with rare diseases who will likely see fewer treatment options under that law. Rather than embrace these avenues for viable reform, however, the budget seeks to expand the program scope with no attempt at improved transparency, certainty, or mitigation. Further, the President's budget request affirms an overreaching mandate that would force more nursing homes to close their doors and result in less access to home and community-based services for Medicaid beneficiaries. This document highlights divisions and misses vital opportunities for productive, patient-driven partnerships with Congress. We will continue engaging with your department on a host of healthcare hurdles that demand policymakers' attention. You have rightly raised concerns, for instance, around the ongoing surge in medication shortages, including for life-saving therapies. The chairman and I recently released a white paper outlining potential solutions to prevent and mitigate this crisis. And we look forward to working with HHS and CMS to develop legislation designed to achieve these goals. We also stand ready to partner on proposals aligned with the President's cancer moonshot, including by ensuring that seniors can access innovations like multi-cancer early detection screening. Those tests can be invaluable for a cancer moonshot. Earlier this Congress, I joined Senator Bennett in reintroducing our bill to grant Medicare coverage for these technologies and bipartisan majorities in both chambers. Bipartisan majorities in both chambers have joined as co-sponsors for this legislation. More broadly, while the administration erred in rescinding regulations aimed at expediting access to medical breakthroughs, your department could take a range of steps to restore patients' trust in reliable coverage for medical devices, including by expanding and enhancing the proposed pathway that CMS published last year. Before closing, let me emphasize the importance of timely communication with respect to the cyber attack on Change Healthcare. While your department has recently taken steps, important steps, to issue guidance and flexibility to insurers, providers, and contractors to mitigate the effects of this hack, the over two-week delay resulted in unavoidable uncertainty. Already financially vulnerable rural hospitals and providers with little to no cash reserves required immediate action by the administration to ensure payrolls could be met and services could be continued without interruption. In the coming days and weeks, HHS should continue to update members and stakeholders on efforts to limit further disruption. We have an obligation to build on long-standing legacies of bipartisanship and bolster the clinician workforce, drive value-based care, improve broken payment systems, and ensure long-term access to telehealth. With these joint goals in mind, thank you again for being here, Mr. Secretary, and thank you, Mr. Chairman.